Hello everyone, welcome to Logic Medico. Today's interesting topic is airway management procedures. In this, why do we require this procedure and what are the types of procedure? See, airway management procedures are the one which is required to manage the airways. Whenever the airways are blocked or the person is not breathing because of the airways being obstructed. This is the nose, nasal cavity, nasopharynx. This is the oral cavity. Okay, this is the mouth, oral cavity, oropharynx. And right here is the laryngopharynx. It enters the larynx and then trachea, finally in the lungs. Air can enter in the upper part of the respiratory tract, normally through nose, nasal cavity, nasopharynx. Then it goes through oropharynx, larynx, trachea and lungs. But in case of emergency, we can also breathe by our mouth. So in airway management procedure, we will either use nasal route or oral route. This is the first thing you have to remember. So when can the airway be obstructed? It can be obstructed for normally present structures like the concha of the nose, like the huge tongue, like the mandibular fracture or some clot is there, epiglottis trauma, vertebral column rupture. Okay. In all these cases, these walls which are bounding the airway itself can narrow down the airway, resulting in difficulty in breathing, thereby requiring a airway management procedure. So that is a basic understanding of why we require airway management procedure. So now let's see what are the types of airway management procedure. So the first one is head tilt chin lift maneuver. The second, jaw thrust maneuver. Third procedure, oropharyngeal airway. Fourth, nasopharyngeal airway. Fifth, one-hand bag mask ventilation technique. And the sixth one is two-handed bag mask ventilation technique. So we'll go one by one. So what is this head tilt chin lift maneuver? As the name suggests, with one of the hand of the, this is unconscious patient, is not able to breathe, okay? First we should look for any secretions or any foreign body or anything. If it's visible, we can pull out with our fingers, okay? Otherwise, we have to do this procedure. We have to keep one of our hand on the forehead of the patient and we have to tilt the head so that the airway becomes straight here. Otherwise, the airway is a curved channel, right? So now because of the head tilt, airway is straight. Once the head is tilted like this, there is a natural tendency of the tongue to fall backwards and close the epiglottis and the laryngeal inlet. Okay. Therefore, we have to do something called chin lift. When we lift the chin of the patient with the help of two fingers like this, when chin is lifted skywards or upwards, along with the chin or the mandible, even the tongue is pulled forward, opening the airway. So that is the importance of head tilt chin lift maneuver. Tilting the head causes the airway to become straight. Lifting the chin causes the tongue and mandible to be pulled forward, preventing it from falling back into the laryngeal inlet. I hope you understand this airway management procedure. The second type of technique is to open the airway is jaw thrust maneuver. Again, we should look for any secretion or obstruction by a foreign body in the nasal orifice and the oral orifice. But jaw thrust maneuver is done where the observer is doing the procedure from the head end of the patient. He is standing here using both the hands, and as you can see, the three fingers are behind the angle of mandible. One finger is in the lower border of mandible. Thumb is at the level of the forehead. So you have to hold on to the head. Otherwise, when you are thrusting on the jaw, what happens? Even the head moves, right? So you want the head to be here only, but the jaw has to be lifted upwards. You can see the arrow here. It is lifted skywards. So in jaw thrust maneuver, what we are trying to do is, we are trying to hold the mandible stable, putting the fingers behind the angle of mandible and one of the forefinger, that is the index finger, on the lower border of mandible, and we are trying to lift the mandible forward. By doing so, what is going to happen? When you lift the mandible forward, the tongue moves forward, thereby it cannot obstruct the laryngeal inlet. Okay, that is a jaw thrust maneuver. Next, in certain patients, if we are in a hospital setup, we can do oropharyngeal airway. It's very simple. We have to take a suitable oropharyngeal tube Okay, we can measure it from the level of the angle of the mouth till the level of the angle of the mandible or the tragus of the lobule of the pinna or tragus of the pinna. So this oropharyngeal airway we have to do only in a unconscious patient. If the person is conscious, they will spit this out. Okay, that's it. Oropharyngeal airway. We have to in a swirling fashion. In a swirling means in a spiral fashion. We have to first put this. This is a curved tube, right? First, this nozzle will be touching the palate. Okay, in that fashion we have to push. Then after it reaches the level of the posterior part of the palate, we have to turn it 180 degrees in such a way it now points downwards. Then this end, which has got a extra grip and surrounding projection, will be near the incisor teeth, and you can see the inner end of that. The inner end of that is there in the laryngeal inlet. This is called oropharyngeal airway. In a hospital setup, we can do this instantaneously. So we are naturally preventing. You can see this. This is a tongue. So oropharyngeal airway connects the oral cavity. This is the nozzle is there here to the laryngeal inlet, and naturally it's preventing the tongue from falling backward on the laryngeal inlet. So this is a very easiest, safest thing to prevent the tongue from falling backwards into the laryngeal inlet. Nasopharyngeal airway can be done in an unconscious patient and conscious patient. Here first we have to measure the nasopharyngeal tube from the ala of the nose till the level of, you can see, lobule of the ear. This is the measurement we have to take because each person's face is different. We have to measure the nasopharyngeal airway tube first. Then we have to put a gel to this, wear the gloves, aseptic precaution gel, and then we have to insert through the nostrils slowly in a spiral fashion. Okay, in such a way this ends up in the laryngeal inlet. Okay, so that is nasopharyngeal airway. Here the interesting thing is this can be done in both conscious and unconscious patients. Next, moving on to one hand bag mask ventilation. What is this one hand bag mask ventilation? We have a bag called the Ambu Bag. You can see that here. The person has to squeeze this. This itself is a main question. We don't want to go to the details of that. So Ambu Bag, this is a connector, okay, and it can be connected to either the oxygen cylinder, okay, or to a reservoir. So this Ambu Bag, we have to squeeze the bag, but the mask, facial mask, selection of a suitable facial mask is also based on the size of the nose and chin of the patient. We have to measure and select. This facial mask is firmly held in position by C and E pattern. You can see that here. C, this is resembling the alphabet C. That is the thumb and the index finger. So it is, the person is pushing firmly downwards. So this seals the gap between the mask and the face. There is no leakage of air here. Okay, this is E technique. This is alphabet E. These three fingers, 1, 2, 3, like this. This is E. So what is this E doing? As you can clearly see in this mannequin, these three fingers are pulling this chin upwards, because when you're pushing this downwards, tongue may fall back, right? So it will obstruct the laryngeal inlet. To prevent that, with these three fingers we are lifting the chin upwards. It is a E technique. You can see that here, C and E technique clearly. This is a C, the thumb and the index finger, to firmly hold the mask against the face of the patient. The E technique pulls the mandible or the chin upwards or skywards, preventing the tongue from obstructing the laryngeal inlet. C and E technique of holding the mask, and one bag will be there. It's an Ambu Bag through which the air is pumped in. This is a naturally available air. The air is here. The person is not able to breathe that. So we are just using this bag to pump the air in. Okay. So many techniques are there, and number of breaths depends on the circumstance, and so many factors are there for that based on the age of the patient also. We should determine. We will not go into the details of that. We'll move on to the two-hand bag mask ventilation technique. So when do you use two-handed? See, this is very strainful. You will get fatigued early or tired early. So whenever two persons are there, especially in the hospital setup, one person can hold. You can see one person is holding with both the thumb and the index finger. It's C technique. This will seal the mask onto the face. He is using the E technique to pull the chin or the mandible upwards. Along with the tongue will move forward to prevent the closure of laryngeal inlet. Okay, so then another person with both the hands is holding the Ambu bag and is squeezing the bag. He's calling 1, 2, 3, 1, 2, 3, 1, 2, 3. Then this person is squeezing. After squeezing 1, 2, 3, 1, 2, 3, like that he will be doing. Okay. So that is two-handed bag mask in hospital setup. When more than one person is there, to prevent the fatigue, we can do this technique so that the person should be able to breathe oxygen. Oxygen should undergo exchange and it has to be gone to the vital organs like brain. Otherwise, ischemia to the brain for less than 6 minutes, that's fatal, or a person is brain dead. Thank you for watching and learning from Logic Medico. To summarize the airway management procedures, head tilt, chin lift maneuver. Head will be tilted backwards and chin will be lifted forward. Jaw thrust maneuver, where the jaw will be pulled forward. Along with the tongue will move forward. Oropharyngeal airway, where you put the tube through the oropharynx. Nasopharyngeal airway, put through the nose and the nasal cavity and nasopharynx. One handbag mask ventilation, where one hand is used to hold the mask, another hand is used to hold the bag. Two-handed bag mask, where two people are there, two personnels are there. One person will hold in C and E technique, they hold the mask across against the face, and another person will hold the bag with both the hands and then squeeze the Ambu bag to ventilate the person. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel and don't forget to press the thumbs up icon and share this video with your friends. Thank you once again.